Hi guys, so I'm doing this vlog on irregular periods to answer a viewer's question that was sent to me. It said, "Hey Dr. Renee, I hope you can help. I'm 29. I've been having regular periods for about 3 years now, but over the last few months my cycle has become irregular. My period came late again this month and last month, and I've started getting heavy periods. It's draining me physically and mentally. It's not painful, but I'm feeling weak. Do you have any advice or information on what might be going on? Thank you." So, irregular periods can have many causes, so I thought the best thing to do was to describe the most common cause and then point you in the right direction so that you know what to ask when you see your GP, and you must see your GP. That's really important. So just to recap, a period or bleeding each month occurs 14 days after an egg is released from an ovary during our reproductive years, which are usually from 12 to 51 years old. A little bit of variation either side. Anything that can delay the release of that egg can cause or even stop periods for extended amounts of time. The most common causes of this include, but are not limited to, polycystic ovarian syndrome, PCOS, pelvic inflammatory disease, PID, infection, stress, thyroid dysfunction, excessive exercise, low BMI and malnutrition. So let's talk about PCOS. In PCOS, cysts form on the ovaries and ovulation can be delayed from a few days to years. The cysts build up in the ovaries, which secrete higher than usual levels of the male hormones, the androgens, particularly testosterone. This causes all of the other reproductive hormones to become imbalanced, and blood tests can see raised LH, FSH, testosterone, prolactin, FAI, and or low SHBG and oestradiol. This in turn can be caused by and cause obesity, lead to excess facial hair, hirsutism, male pattern baldness, anger, mood changes, and heavy periods and infertility and migraines can occur. PCOS is easy to test for. You need 2 of the following for a diagnosis, and this person already has 1. So 1 is irregular periods, 2 is deranged female hormones, and 3 is polycystic ovaries on an ultrasound scan. If PCOS is causing the problem, there are lifestyle and medical solutions. Losing just 5% of body weight can trigger ovulation and help normalise those hormones. There are medications to lower testosterone, high progesterone containing contraceptive pills, spironolactone, a blood pressure pill, and metformin, which is a diabetic drug which can help weight loss and trigger ovulation. The evidence is weak, but I have seen it work, and I have seen patients get pregnant via metformin in PCOS. So pelvic inflammatory disease and infection. Infection itself, or the more serious complex pelvic inflammatory disease, can cause irregular bleeding. You might also get other symptoms which include offensive discharge, yellow-green, smelly, abdominal pain and fever. It is important to recognise and treat infection as quickly as possible to minimise permanent damage to the fallopian tube. That's the tube that carries an egg from the ovary to the womb. This is usually simple enough, and a vaginal swab, either self-done by you or by a nurse or doctor, is the first approach. Then an ultrasound scan depending on the swab. Stress. Stress can alter periods dramatically. I have seen stress cause periods to stop for over a year in some patients. This is thought to occur because stress hormones such as adrenaline and cortisol that you secrete more of when you're stressed directly interfere with menstrual hormones. Now obviously this is very difficult to manage, especially when you're worried about it. So other than to remove or manage the cause of stress, and try to take remedial relaxation steps like yoga and acupuncture, it's difficult to cure, but stress can be a big cause of irregular periods. Thyroid dysfunction. The thyroid gland, situated in the front of the neck here where mine isn't, it's a butterfly-shaped gland that is the engine room for just about every process in the body. When it's working overtime or going slow, it can affect periods. So when it's going slow, they actually come sooner than normal, and they are very heavy, and when it's going fast they are further apart and much lighter. So there is a direct effect on periods. There's a simple hormonal blood test for this, but make sure your doctor asks for all of the thyroid hormones, so TSH, free T4 and free T3. Low BMI and malnutrition. Excessive or rapid weight loss can result in periods becoming less regular or stopping irregular. It causes parts of the brain to stop releasing the hormones that are involved in the very complex menstrual cycle. This causes what we call hypothalamic amenorrhea, absent periods. Alongside this, you may develop dry skin, hair thinning, tiredness, difficulty concentrating, difficulty getting warm, low mood. It usually happens when your BMI drops below 18.5, and it usually needs expert help and management. Excessive exercise can also interfere with the hormones responsible for periods, often seen in female athletes, dancers and others who train intensively. If intense exercise is combined with a restrictive diet, a person might develop the female athlete triad, or REDS, and this includes disordered eating, menstrual changes and low bone density, so osteoporosis. Some people find it hard to stop exercising. It's an addiction, and the medical term for this is compulsive exercise. Again, this will need specialist input from somebody who really knows this area well. And finally, it might sound obvious, but don't forget to ensure that you're not pregnant. Some women carry on bleeding throughout pregnancy, but it can be different. It can be lighter, it can be irregular, it can only happen a few times. So it's always an important test to do. So hopefully that's given you some of the things to look for if your periods have suddenly become irregular. So definitely testing for PCOS, and it's simple blood test and an ultrasound that you need. Definitely testing your thyroid function, having a look at how much you're exercising, what your BMI is, and lowering your stress levels. Also checking for, obviously we mustn't forget, for infection. And if you've got any signs of PID, which is the more serious infection that's moved deeper into your pelvis, then you must see a doctor urgently. So I hope that helps, and I hope it answers the question. We'll put the notes below so you've got a reference point, but do ask me questions and I will do videos to answer them. All right, everybody, take care.